Hi, everybody. I recognize some of the names of the folks in the room, and I've really enjoyed participating in this remotely and really getting to hear people's voices and the ideas. It really does come across differently when you're just listening to people's voices, not seeing their faces. It's an interesting kind of experience. But anyhow, my background is really in medicine and public health, and I like to tell people that when I was a doctor, everybody knew what I did. I didn't have to explain to people, why I did what I did, how I did what I did. They just assumed doctors see patients, they practice medicine, and that's a good thing for society. When I went into public health, all of a sudden the percentage of people who actually understood what I did dropped dramatically. And people just didn't really understand what public health did, and you have to explain it to them in terms they understood, like, well, we inspect restaurants, we make sure that babies are healthy, we provide a whole host of services to prevent infectious diseases, and people are like, oh, okay, I understand that. When I got into philanthropy, and particularly in health philanthropy, the percentage of people who understood what I did dropped even further. And I finally started to realize that this has to do with the fact that we have a fundamental narrative in this country about what health is. And when you try to do something that looks at the environment in which people try to find health opportunities, and you try to describe that to people, it runs up against this narrative very quickly and very firmly of health is about medical care and health is about individual behaviors and individual responsibility. And so we at the California Endowment have become convinced that there are a whole host of environmental and ecological influences on health that are profoundly impactful on the health of populations, not just low-income populations, but across the entire economic spectrum in this country and, in fact, the world. Yet when we try to invest, and many of our foundation colleagues that are in the room here have had this similar experience, when we try to invest in helping to intervene and reshape some of those environments and the policies that produce those environments, we run up against this sort of, silence, this sort of sense of, well, how is this health? This doesn't sound like health. And again, recognizing very quickly in our work that we needed to actually start intervening not just in the conditions in communities, not just in the policies and practices that shape those conditions, but fundamentally in the narrative that drives the policies and practices that create the conditions. And that narrative has a number of components. One, it's about what is health. We have to broaden the story of what is health beyond just health care and individual behavior to the ecological influences and factors that shape people's health opportunities. And we have to change the messengers. It's not just people wearing white coats and having stethoscopes around their necks that know about health. Many people know about health that don't even know that they actually are working on health issues in their communities. So we got behind this project almost immediately, having worked a little bit, although not having funded Weight of the Nation, but having worked with Weight of the Nation, having seen its incredibly powerful impact on our communities in California where we're working collaboratively to try to change environments. We got behind this, the Public Good Project and A Healthier America, quite enthusiastically because, as Harvey said earlier, we are on a trajectory in this country that is kind of a crisis trajectory. And if we don't get a handle on this, we're in for some really, really rough times. And the narrative, the ability to start to broaden the narrative about what is health, and to have an informed conversation about those kinds of policies and practices and the environmental conditions that help people either pursue healthy opportunities or present barriers for people in pursuing healthy opportunities. Until we can have a constructive conversation about that, we're in some trouble. So that an investment in trying to change the narrative in a sustainable, ongoing way, to me, seems like a very prudent investment in health. And the last thing I would say is that when you think about something like Sesame Street, and the power of Sesame Street to essentially change people's understanding of the need to invest in childhood literacy and early childhood development. And, to create in the minds of policymakers an understanding and a familiarity and an acceptance of the notion that education isn't just what happens in the schools, it's what happens in communities, and it happens across the entire socioeconomic spectrum, and that's an important thing for our country to get behind. I think that this has the same potential if we can design it right and organize the right kinds of messages and messengers to broaden the narrative in health in this country. Thanks.
Thank you, Tony. And now Gail Ober.